Okay, well, my background is I am a lifer here. I have lived in the Youngstown area for my entire life, and my father's family in particular has been in the same town where I live since the late 1700s. So we've not migrated very far from that spot, at least in the last few hundred years. My background in nutrition. Actually, it started when I was a child. I grew up with many food allergies, so I spent a lot of time at the Cleveland Allergy Institute when I was a child, and spent a lot of time in doctor's offices, and spent a lot of time doing food elimination diets. I feel bad for my mom because she was very young and she had to deal with an allergy child who had rashes and asthma and couldn't eat a lot of things that everybody else could eat, so it was tough on her. My mother was always very interested in nutrition, so she was always taking us to the library and she was getting books out about health and eating, so I really have to credit her for, I guess, stimulating an interest in healthy eating. So I majored in foods and nutrition was my major. I was not able to find a job when I graduated. I think there was a lot of economic hardship at that time, and there just weren't a lot of jobs. And so I thought, well, what am I going to do? I'm not just going to sit at home. I'll just go back to school. So I applied for a graduate assistantship. Both of my degrees, bachelor and master's degrees, are from here, YSU. And I came back to school, and I didn't want to limit myself, and there was not a nutrition master's at the time, so I thought, well, I'm going to major in education. So my master's degree is in education with an emphasis in health education curriculum, and I remember it broadening my horizon on this whole health continuum. And at that time, when AIDS was a new condition and HIV was, in the news and in the newspapers, my major project was on HIV education for middle school children. So I expanded my knowledge base, into the more general topic of health. Yeah, we talk a lot about the traditional medical model where we focus on just fixing people or treating the disease. With health promotion, you're much more focused on prevention, not ending up in that situation, because it brings physical pain, but it brings a lot of emotional trauma too, to people having to deal with these chronic conditions. There's just so much you observe on an everyday basis, not just in your work life, working in a hospital or a clinic, but just watching people around you. You can see people suffering with things that they don't necessarily have to suffer with, or if they would have made different choices, they wouldn't be suffering with.
Thank you so much. I guess next question is, what is your role here at YSU?
So my role here at YSU, I am a professor and I am a program director. I have been a program director for the dietetic technician program, which we no longer have. I've been the program director for the didactic program in dietetics, which we do have. I was the program director for the coordinated program in dietetics, which has now been replaced by what we call the dietetics future model. So the dietetics future model is moving our profession, much like other healthcare professions, to the graduate level. So it is a hybrid between dietetics, a master's in public health, and it also includes the internship or supervised practice component that people need to sit for the registered dietitian exam. So right now I'm the program director for that. So I incorporate wellness into my everyday life by making sure, or doing a variety of things. I call it slice of life changes. I really rebel against prescriptive health advice. Like, I don't like the word exercise, but the word activity or active is okay. Busy, active is good. So I try to diversify, I guess. So, health is made up of a lot of different things. It's not just one thing. So I try to look at all of the different aspects of health and make sure that I'm addressing all of those. So trying to get enough sleep, quality sleep. I try to drink as much water as I can, and whatever tricks I have to do to make myself do that. I have an active spiritual life because I think that's an often overlooked component of health, that people, they just don't think about it, or maybe they ignore it. So I try to establish a regimen for myself, and it's okay. I mean, none of us is perfect, and we all struggle with one area more than another. So just being honest about it and trying to encourage each other, I think, is the important thing. Yes, so healthy eating is again about balance, meeting that balance. So not eating too much of one thing and not enough of the other. One of the reasons we have these guidelines like the food pyramid or the My Plate is because it shows you how you want to have a little bit of everything from a lot of places. And the people that have the most, we talk about diversity a lot. That's a topic, but you know what? You need diversity in your food too, because the more diverse your food is, the more likely you are to get the nutrients that you need. So getting into the food rut where you're only eating, the same things all the time is not healthy for you. Oh, well, I know budget's definitely an issue when you're a college student, so trying to eat healthy on a budget. So definitely that can be challenging. I know the temptation for alcohol consumption also is there at that age. But, there are, one of the best ways to improve your diet as a college student is trying to incorporating, I know might sound funny, but incorporating more legumes and beans in your diet. Beans are an excellent protein source. They're also low in fat or fat-free, have a lot of nutrients in them, and they're very inexpensive. So one of the things that people can do to get healthier is incorporate more beans in their diet. So I think all the college students should take my food science and management class because we talk about these things. But there are ways to do it. You just need the tools and the help to show you how to do it. Right. We also have a food pantry here in Cushwa on the 3rd floor. And my students are actually going to be working with the food pantry this coming spring. And one of the things they're going to be doing is helping to create resources and information. So not just helping to distribute the food, but okay, what do we do with it? How do we maximize this? How can we make, reasonable recipes out of this? What does it do for us? And incorporating some of that education. Oh, I would say don't be afraid to ask for a registered dietitian when you go to your family doctor. And I know one of the questions doctors are asked about most is about eating, healthy eating, and ask for a referral to a registered dietitian. And we also have registered dietitians here on campus, the faculty members here, full-time and part-time. Well, thank you. I'm glad to be of assistance, and I'm glad to talk anytime.